The current aim of the National Health Service is to seek new collaborative ways of working that make effective use of people's skills, knowledge and training to improve the quality of care they provide to our patients and enhance their experience of working in the NHS. Over the coming 5 years, we will support every NHS employer to minimise bureaucracy and reduce the burden on our workforce so they have more time to focus on delivering quality care. This will be enabled by digitally passporting information such as identity, training skills and professional status to onboard staff more effectively.
Each movement of an employee from one NHS organisation to another often includes several days of waiting for administration checks to be completed before the employee can commence work. Information from many different sources needs to be verified, and the process often involves a combination of face-to-face ID checks, photocopying of documentation, and digital checks with external bodies. These checks may need to happen several times a year for just one employee, as they cover shifts in different organisations, and this can happen more than 400,000 times a year across the NHS.
When faced with these challenges, we asked what we could do to improve the process. We decided to partner with industry and the open standards community to reimagine the process at scale and to give staff greater control over the sharing of their professional details.
Working with Microsoft and Sidekick Group, we successfully delivered a proof of concept which demonstrated, by using verifiable credentials, that clinical demands could be met rapidly and with a high level of security and trust. We demonstrated that medical staff in Blackpool teaching hospitals could collect credentials for identity, skills and experience, and these credentials could be passported and shared by staff to meet their onboarding requirements at Lancashire teaching hospitals and other NHS organisations. It gives us a tool to rapidly meet patient demand by reducing the time our staff are waiting for administration checks to be completed before being by the bedside.
Working together, we are using open standards for verifiable credentials and decentralised identifiers to adopt the digital capabilities needed to realise the vision. This will truly enable us to more effectively use our people's skills, competencies and experiences to improve the quality of care provided to our patients and enhance their experience of working for the NHS.